Hypertension. 1.1 Introduction to blood pressure. Blood pressure is the force exerted by circulating blood on the walls of the body's arteries, the major blood vessels. It's an essential physiological parameter that reflects cardiovascular health. It is measured in millimeters of mercury, mmHg, and recorded as two numbers. Systolic pressure, upper number the pressure in arteries when the heart contracts and pumps blood. Diastolic pressure, lower number the pressure in arteries when the heart rests between beats. Example, a reading of 120/80 mmHg means a systolic pressure of 120 mm of mercury and a diastolic pressure of 80 mm of mercury. 1.2 What is hypertension? Hypertension, high blood pressure, is a chronic medical condition in which the force of the blood against the artery walls is consistently too high. While blood pressure fluctuates naturally throughout the day due to activity, stress, and sleep, in hypertension the elevation is persistent, leading to potential long-term damage to the heart, brain, kidneys, and other organs. 1.3 Clinical thresholds. The diagnostic thresholds for hypertension vary slightly by medical guideline, but according to the American Heart Association, AHA, and European Society of Cardiology, ESC. Category systolic, mmHg, diastolic, mmHg. Normal less than 120 less than 80. Elevated, prehypertension, 120 to 129 less than 80. Hypertension stage 1 130 to 139 80 to 89. Hypertension stage 2 greater than or equal to 140 greater than or equal to 90. Hypertensive crisis greater than 180 greater than 120. 2. Explanation of hypertension. 2.1 Pathophysiology, how it happens. Hypertension develops due to increased resistance in the arteries or increased cardiac output. The main contributing factors include arterial narrowing, plaque buildup, atherosclerosis, or vascular stiffness increases resistance. Increased blood volume. Due to excess salt intake, kidney dysfunction, or hormonal imbalances. Overactive sympathetic nervous system, causes constriction of blood vessels and increased heart rate. Hormonal influences, such as excessive renin-angiotensin-aldosterone system, RAAS, activity. 2.2 Types of hypertension. 1. Primary, essential, hypertension. Accounts for 90–95% of cases. No single identifiable cause, linked to genetic, environmental, and lifestyle factors. Risk factors, aging, obesity, high salt intake, lack of exercise, stress, family history. 2. Secondary hypertension. Caused by an underlying medical condition. Potential causes. Chronic kidney disease. Hormonal disorders, Cushing's syndrome, hyperthyroidism, pheochromocytoma. Certain medications, oral contraceptives, NSAIDs, steroids. Sleep apnea. 2.3 Risk factors. Non-modifiable, age, genetics, race, African ancestry has higher prevalence, family history. Modifiable. Obesity, diet high in sodium, alcohol consumption, physical inactivity, smoking, stress. 2.4 Complications if untreated. Persistent hypertension can lead to target organ damage. Heart, coronary artery disease, heart failure, left ventricular hypertrophy. Brain, stroke, transient ischemic attack, cognitive decline. Kidneys, chronic kidney disease, end-stage renal failure. Eyes, hypertensive retinopathy. Blood vessels, peripheral artery disease, aneurysms. 3. Diagnosis of hypertension. 3.1 Measuring blood pressure. Office measurement, using a sphygmomanometer, manual or digital. Multiple readings over several visits are necessary to confirm. Ambulatory blood pressure monitoring, ABPM 24-hour monitoring for more accurate assessment. Home blood pressure monitoring, HBPM useful for tracking trends and detecting white coat hypertension. 3.2 Diagnostic criteria. Hypertension is diagnosed when average blood pressure readings on at least 2 different occasions meet or exceed greater than or equal to 130/80 mmHg, AHA guideline. Greater than or equal to 140/90 mmHg, ESC/WHO guideline. 3.3 Additional evaluation. Once hypertension is detected, further tests assess underlying causes and target organ damage. Blood tests, kidney function, creatinine, BUN, electrolytes, lipid profile, blood sugar. Urinalysis, proteinuria detection. ECG/echocardiogram, cardiac effects. Eye examination, retinopathy check. Imaging, renal ultrasound if secondary cause suspected. 3.4 White coat and masked hypertension. White coat hypertension, elevated readings only in a clinical setting. Masked hypertension, normal readings at clinic but high at home/work. 4. Treatment of hypertension. Treatment aims to reduce blood pressure to safe levels to prevent complications. This involves lifestyle modifications, pharmacological therapy, and monitoring. 4.1 Lifestyle modifications, first line for most patients. 1. Dietary changes. Adopt diet, dietary approaches to stop hypertension. Rich in fruits, vegetables, whole grains, lean proteins. Low in saturated fat, cholesterol, sodium. Limit salt intake to less than 2,300 mg per day, ideally less than 1,500 mg per day. Reduce sugar and processed food consumption. 2. Physical activity. At least 150 minutes/week of moderate aerobic exercise. Include resistance training twice a week. 3. Weight management. Aim for BMI 18.5 to 24.9. 4. Limit alcohol. Men, less than or equal to 2 drinks/day, women, less than or equal to 1 drink/day. 5. Quit smoking. 6. Stress reduction. Yoga, meditation, breathing exercises, adequate sleep. 4.2 Pharmacological treatment. When lifestyle changes alone are insufficient or in high-risk patients, medications are used. Main drug classes. 1. Diuretics, thiazides, loop diuretics, potassium sparing. Reduce blood volume. 2. ACE inhibitors, e.g., enalapril, lisinopril. Block conversion of angiotensin I to II, reducing vasoconstriction. 3. Angiotensin II receptor blockers, ARBs, e.g., losartan, valsartan. Block angiotensin II effects on blood vessels. 4. Calcium channel blockers, CCBs, e.g., amlodipine, diltiazem. Relax arterial muscles. 5. Beta blockers, e.g., metoprolol, propranolol. Reduce heart rate and cardiac output. 6. Others, alpha blockers, centrally acting agents. Combination therapy, often required when a single drug doesn't achieve control. 4.3 Treatment goals. For most adults, 130/80 mmHg. For elderly, slightly higher targets may be accepted to avoid side effects. 4.4 Monitoring and follow-up. Regular BP checks, home or clinic. Periodic lab tests to monitor kidney function and electrolytes. Adjust medications as needed. 5. Hypertension in special populations. Pregnancy, gestational hypertension and preeclampsia require careful management. Elderly, greater focus on minimizing side effects and orthostatic hypotension. Children and adolescents, rare but increasing due to obesity. 6. Prevention strategies. Maintain healthy weight. Regular exercise. Balanced, low-sodium diet. Limit alcohol, avoid smoking. Manage stress proactively. 7. Conclusion. Hypertension is often called the silent killer because it typically causes no symptoms until damage is severe. Early detection, lifestyle adjustments, and proper treatment can dramatically reduce the risk of stroke, heart attack, kidney failure, and premature death. Public awareness, routine screening, and long-term commitment to a healthy lifestyle remain the pillars of control.